Dr. Mogusu's widow, who asked that we conceal her identity due to the sensitivity of the case, says that true to the late doctor's empathetic nature, his last moments after contracting the COVID-19 virus was spent issuing a caution to his fellow doctors about dark days ahead. This, considering that he passed on as a man who had not been paid his 5-month dues, worked without being provided with personal protective equipment, health insurance, and other actions that showed a vacuum in the duty of care owed to him by the government.
He was providing services to Kenyans that he himself could not afford. We didn't have money for deposit to take him to KU initially.
It is upon this basis that the family of the late Dr. Stephen Mogusu moved to court to file a petition on the basis of wrongful death against the Ministry of Health, the Public Service Commission, amongst others.
He is entitled to pay, as everyone is, who is working, especially government workers. Number two, he was entitled to a medical cover. It is quite ironical that a doctor would lack a medical cover.
Curiously, the Public Service Commission swore an affidavit and attached a letter confirming that the late Dr. Mogusu contracted COVID-19 in the course of his employment and agreed that his legal representatives were entitled to compensation. They further instructed the Ministry of Health to engage the petitioners in discussions aimed at settling the matter out of court.
So we are not looking at it from the point of, the compensation in financial terms, but just looking out to also fight for justice for him, and just get the whole thing settled.
The lack of a response for over 1 year from the Ministry of Health, led by Cabinet Secretary Susan Nahumicha, is even more strange, considering how much the previous government, including then Deputy President William Ruto, spoke at length about the late Dr. Mogusu's death. The focus is indeed on the Ministry of Health to see if they will actually right the wrongs of the past or fail him for a second time, throwing the spotlight once again on the conditions doctors face as they take to the front line. We reached out to the Ministry of Health via their official email and mobile phone lines to inquire about the petition that they have reportedly yet to respond to, but we received no response.